This week on Coronavirus Explained, we're returning to the issue of how to safely reopen schools and also the impact on children of not attending. In some countries, schools have been closed for 5 months by the end of the summer break. Here in the UK, the Royal College of Paediatrics and Child Health sent a strongly worded letter to the government this week. It was signed by 1,600 paediatricians saying this interruption is without precedent and risks scarring the life chances of a generation of young people. Left unchecked, COVID-19 will exacerbate existing problems and deepen structural, social and health inequalities. School is about much more than learning. Globally, nearly 1.1 billion students in 123 countries are still learning remotely, but many have had little or no contact with the education system at all during lockdown. A UK study showed that a third of pupils were not engaged with their lessons. Just 42% had returned any homework, and pupils in the most disadvantaged schools were the least likely to be engaged with remote learning. The French Education Minister said last month, many doctors say it's less dangerous to go to school than to stay at home. Our children mustn't be the victims of collateral damage of our health measures. So how safe is it to reopen schools? How could a long absence affect children's educational outcomes and their physical and mental well-being? I'm joined now by Saul Faust, Professor of Paediatric Immunology and Infectious Diseases at Southampton University, and Christina Tortorelli, Professor of Social Work at Mount Royal University in Calgary, Canada. Good to have you both with us. Saul, is it time for children to go back to school?
Well, I think we said this in a paper over a month ago now. I think we know very clearly that children are less affected by COVID, both in terms of disease severity, but also looks like in terms of infectivity and how they pass it on. The data aren't strong enough to say this for absolute certain, but more and more circumstantial evidence is appearing in the literature that just backs up the same information. And children almost certainly will be able to go to school without risking themselves or their teachers, even if they pass on COVID, even if there are cases, if the world and countries concentrate on what you're supposed to do in a public health emergency, which is keep everybody safe by contact tracing, picking up cases and isolating people who've got COVID disease. That doesn't mean detecting COVID in children in school. It means if there's people with symptoms, isolating them and keeping them at home with their contacts. Because teachers are probably far less at risk from children than other groups of professionals and workers in the community, because children are going to transmit and be less affected by COVID. Of course, there will be some risk to people's families, but far less risk than what we've seen over the past few weeks, which is people just choosing to go to the beach and go to mass demonstrations. So it's become overly political, and we need to focus on children. We need to make sure the school's open, and we need to stop asking quite ridiculous things of our children and our teachers, such as social distancing in primary schools or 2 meters in secondary schools. These things, almost certainly, we will look back with the eye of history and say, this was ridiculous. I could carry on, but it sounds like a rant after a while.
Well, let's bring in Christina, because the one thing that she's an expert on is just what schools provide that's not about education, all those extra things our schools provide. What are child welfare workers worried about in Canada?
Good morning. They're worried about a lot of things, and I've had an opportunity to talk with colleagues in the field. And schools provide so much for children. They provide, for example, meals for children who are vulnerable. So some children, across at least Canada, receive breakfast and sometimes lunch at school. And those are 2 important pieces of their day that they wouldn't get at home in the same nutritional way, if at all. So those things are missing for students who are at home. Schools provide a relationship and safety. And so in the child welfare world, schools are often a reporting source. not to have children removed from a home, but to just express concern and ensure that there's some supports available or some coordinated planning with the family to make sure that kids are not in an abusive environment, that families are coping the best that they typically can and are able to do better. Right now we have children home, parents home, no childcare. That's just opening up here. Again, and in small ways, so smaller numbers of children in childcare centers. Schools are still effectively closed. It's June, so it's the end of the school year. And those families are at home. Even the ones that were doing well before COVID are now experiencing some significant struggles of being home 24/7, parents not necessarily getting along, financial stresses. It's stressful to go out and get your groceries, job loss, all of those kinds of things that are happening. And on top of that, this need to do their best to have an education at home for their children. So I do worry a lot, and child welfare workers are worried a lot. The ability to go out and see a family to really understand what's going on has been complicated, and so they've been doing a lot of that online, which doesn't give you the same perspective for sure as being out in a home with a family in their own environment.
Saul, do you feel that you have enough evidence now to reassure parents, to reassure teachers, or are we still in uncharted territory to an extent?
I think we've had enough evidence from the beginning of the pandemic that children are not going to be at great risk. You know, my three children in the UK in year 4, year 7 and year 8 have been in school because my wife and I are key workers. My wife's a family general practitioner in the UK. They've been at school with other key workers' children, and this has happened all over the country. And there have not been, you have not heard in the news of major outbreaks in schools or the teachers who've been looking after the key workers' children, even though we're supposed to be the high-risk families working in hospitals with children who are with us in the evenings and overnight and so on. So I think the evidence will accumulate. It would be really nice to have the opportunity to study transmission, not by experimenting on children, but actually as the children go back to school, looking at using salivary swabs at just how COVID does transmit between children and whether people are affected. But, you know, the safety is provided by contact tracing and public health intervention, not by an experiment. And so we really we've been in a position for weeks now where this is straight political failure globally and not concentrating on children. And as usual, economies not considering the most vulnerable in society, which are the kids at school who have all the problems you've been describing in the last 10 minutes.
And Christina, we've been talking about those issues of safeguarding and how important a role schools play in that. But what about the very simple thing for kids, the breakdown of structure and routine in a day? How does that affect children when they don't go to school?
Absolutely. I'm very worried about the students who are going to return to school. They have been without structure. The children who do the least well with structure have lost probably all of that, both at school and at home. And so for them, readjusting to the school environment, if it's the same as it was before, and then readjusting if there are some changes in the school environment due to COVID-19, that is going to be very difficult for them. And I think that their families, their teachers, everyone around them, and the students themselves are really going to struggle. We're going to have a much more vulnerable population moving forward the longer that we have children out of that structure.
Saul, how worried are paediatricians about the long-term effects on our kids' mental health because of this?
I think you can see from the fact that I think it's over 2,000 members of the college have now signed the letter within a couple of days. I think everybody is concerned about the mental health, the physical health, the social health of children. These are unquestionable. Nobody's denying it. The failure is of globally politicians and in the UK of actually making decisions that will open the schools again.
So briefly, Saul, is there a country that's getting it right? Because some countries have got their kids back in school, like Germany and Denmark.
Germany and Denmark, where we're not having large reports of problems in schools, and the reports of infections where there have been infections in schools seem to be related to the adults bringing it into the school, not the children transmitting to the adults. And again, you know, people always are looking for, you know, the answers, whether it's 1 meter, 2 meter, are the schools safe, are they not? We've got enough evidence now to be able to say children should be able to go back to school. And if there are problems, it's not going to be the schools that cause the problems. It's going to be the reopening of adults mixing in society that will infect adults, and that might end up in the school. But you can't blame the schools for that. It is so frustrating that children are being used as political footballs, and in a way of sort of diverting from the other failures that have gone on during this emergency, of actually getting a system of tracking, and testing and tracing in place in all the countries where it hasn't happened yet.
Okay, I can hear that frustration from both of you. Saul Faust and Christina Tortorelli, very good to have your thoughts. Thanks for joining us for this week's Coronavirus Explained.